We've got a regional district looking to ask for basically an existing health district to be split up because they're feeling that their needs are not being adequately met the way that the district is set up. Now, we talked about this previously about how in the regions you're going to basically filter through systems up the network until you get to a bigger network, a bigger supplier. So you go through your district hospital to your regional hospital to your base, well, regional slash base hospital, and then off to the big cities, off to the big smoke, and that you've got different levels of support at those different levels. And so they're arguing here that the um, existing Murrumbidgee Local Health District that Griffith is a part of is a little bit too big for the needs of the people in Griffith and the immediate area. And so that the current way that the Murrumbidgee Local Health District provides services out to Griffith isn't good enough for what the population needs. And therefore, they need to split the network and so, yeah, introduce a new district and focus resources like that. But that means cost. Yep. If you live regionally, I mean, Griffith is more. What were they? 10 to 15,000 people, I think. But anyway, they're a regional centre. Not big, not that big. So the fact that he's got leukemia living in proper regional New South Wales and cancer and needed amputations and stuff, you're not going to get that support in Griffith. Plain and simple. I mean, maybe in Wagga Wagga, which would be part of the Murrumbidgee Local Health District, that'd be with the next major site up. Then maybe to Canberra, more than likely to Sydney. And there you go. I mean, he's talking about having to go to Sydney for treatment or Wagga and then a couple of days back in Griffith. And it's like, well, I talked about this the other day that you've had people having to travel hours and hours and hours for treatment or days and days for treatment that if you're working, it's coming at a massive cost to the workplace. And well, these guys are presumably retired, and that the level of care that he requires just isn't being provided in regional Australia. The amount of money needed to have high level oncology services way out in the regional areas just isn't there. I mean, we talked about the ACT having difficulty with psychiatric services and people having to go to Sydney and Melbourne from Canberra, the national capital. And that's why I said Canberra's little more than a large regional centre. And people need to sort of wrap their heads around the idea that outside of the major cities, you're going to face this lack of services. And even if they do break it up, it's still not going to do things. I mean, Griffith to Wagga honestly isn't that far. But yeah, the idea that you need to go and get travel for broken bones. I mean, I've lived in towns that didn't have hospitals, so wasn't far off with my guess. I said 10 to 15, 23,000. All right, so you are looking at a reasonable population centre. Anything over about 15,000 in regional Australia is going to be pretty big as a regional town. I mean, most towns I lived in before going to uni and stuff like that were 6,000 or below. The biggest centres nearby were, well, up to 50,000. They were big regional centres. But there'd be maybe no more than a dozen proper regional centres that were in that 20 plus thousand bracket at the time. Everything else was, yeah, thousands. And I mean, the towns I lived in had satellite settlements that only had hundreds of people living in them. So, yeah, I mean, coming from that lived experience, looking at this is like, and what do you expect? But at the same time, you should demand quality services. That's completely fair. But you've got to temper that with the understanding that you just don't have the resources to support it. And yes, you do need to have these services and support and everything else like that. And it's kind of sad that, yep, there's a shortfall and you don't get that. It's just, uh, it, it's, it's what it is. And hence, you've got to move people up. I talked about this with the Northern Rivers system, that you feed people out of the smaller hospitals, out of your district hospitals, like Maclean and Grafton, and they get fed up to the base hospital at Lismore. And when their cases are too complex for Lismore to handle, you're either shipped off to Sydney or Brisbane, or maybe the Gold Coast. It's just a fact of living in the Australian regional areas, and that these distances can be quite lengthy. Like you can be several hours away from home by the time you get to hospital. Uh, and that's not just someone living out in the middle of a cattle station, well in the middle of the outback. This is someone living in a town slash city of maybe 20 or 30,000 people, which I guess is small by global standards. But for regional Australia, it's actually a pretty decent settlement. And yeah, it's one of those things. You think we live in a very modern tech society with all the services, but you don't have to go far outside the big cities to find this reduction in capability. Would it be nice if there was enough money and resources to do it all? Yeah, but doubt, unfortunately. But we do have some rather uniquely Australian solutions to it all. I mean, well and truly in the outback, flying doctors. Um, we have community nursing, district nurses and stuff would actually carry a lot of the burden for day-to-day healthcare and things like that. They used to be state government funded and things like that. Um, I'm just trying to think. Did all the towns I live in have a hospital? The first one I lived in didn't. Second one, did that have a hospital? Maybe, maybe. It did, but it was a small one. And then the one town of 6,000 used to have two hospitals, and then because one was the Sisters of Mercy and the other one was the government hospital. They shut the government hospital and took over the Sisters of Mercy hospital, and so that became it. And it had a small operating theatre, small emergency department, but yeah, if it was anything more complicated than, I mean, broken bones, I think, simple car crashes, you'd be off to um, the big regional centre, which was up to an hour away, depending on how fast you drove. So yeah, I mean, you'd expect Wagga Wagga to have things, but I mean, they call it rural clinical school and rural. Wagga's got over 50,000 people. I don't necessarily call it rural, but yeah, the problem is the people calling for these additional services are completely valid. Yes, great to have added support for being able to live at home and have those services nearby. Unfortunately, the reality is that it's going to be impossible, unsustainable to fund unless the population in the region keeps growing and everything else, in which case, hey, it'll probably will attract that sort of thing. But it's symptomatic of what everyone in rural Australia, regional Australia encounters.